Well, we are going to do our medical minutes dance with the Thompson twins in the background there. You know by now that means Dr. Tom Rogers from the Cleveland Clinic Union Hospital, and this time Lauren Smith are joining us for medical minutes. Welcome back.
Thanks, Kelly.
Great to have you joining us. And Dr. Rogers, we'll begin with you again from the Cleveland Clinic Union Hospital. Our focus today is on the benefits and sometimes the barriers to breastfeeding.
Absolutely. So, well, it's a pleasure to have Lauren Smith with us today. So Lauren is local and is born and raised here, well, at least raised here. Went to New Philadelphia High School and then went to Kent State Tusk for her degree. So awesome to have her here. And it is Breastfeeding Awareness Month. So in August, as just like we did last August, we wanted to really bring up to attention about everything that the benefits of breastfeeding and what Lauren has done with her team of our lactation consultants at Union. They do a great job. So we really wanted to highlight her today, and also she can talk about the program that we have and what benefits it offers for our patients.
Great. Welcome back, Lauren Smith. How long have you been manager there at the maternity department?
I've been manager for about 3 years over there at the maternity department, Cleveland Clinic Union Hospital. I've worked at the hospital for 19 years. And been on OB for about 14 years of those.
Wow.
Yeah.
Well, so obviously we all need to know, especially if someone is having a child for the first time, what are the benefits of breastfeeding?
So there are some really great benefits that I think people forget, that the mom actually gets benefits from breastfeeding as well. So a lot of what people talk about is the benefits for the baby, the nutrition. It really is the perfect nutrition for the baby because it is made just for that baby. And as the baby grows into infancy and a few months old, that milk changes a little bit to meet the needs of the baby at that point in time too. They are reduced risk of cancers, asthma, different illnesses, infections during their childhood as well. But not just that, so the mom is getting benefits to the breastfeeding as well. She's getting a reduced risk of cancers for breast cancer, ovarian, and uterine cancers. It speeds up her postpartum recovery. And also the convenience and the cost. Breastfeeding is completely free. You know, there's little things you may buy, breast pumps and those kind of things, but that milk is completely free to you and you don't have to buy anything.
You know, Lauren Smith, coming to my mind, I think we addressed this last year when the COVID supply chain issue came up. Yes. And it was a real scare to see some empty shelves in the store with the formula as compared to mom with the real thing. That was really a shocking thing. Even if you've never had a child, it really makes you stop and think. There's nothing better than the creation, what God created with our human beings. And now what about the barriers? Those are some really great points, but what if a mom does have trouble or is afraid? Let's just plain talk. It's frightening when you have your first time experience of breastfeeding.
Right, and so what I find in my experience, I've been doing lactation now for about 10 years, and what I have experienced with our moms in this community is a lot of them just don't have maybe the support, and I don't mean that in a negative type of way, but the kind of support that maybe their mothers, their sisters, their friends did not breastfeed. So they don't really have that exposure to it. So it's just really an unknown, and when you don't know about something, it is a little bit scary. But there are a lot of resources in our community now. We would love to see many more resources get developed in our community, and our long-term plan is to get more support groups and support out there. But we have actually established something. Actually, we just came up on the anniversary of 5 years ago. We opened our outpatient lactation clinic.
Oh, congratulations.
At the hospital.
Oh,
yes,
that's exciting.
So we're trying to get more awareness out there. We are able to utilize it a lot more. We have more lactation consultants and counselors now at the hospital. All of the nurses are trained with basic lactation training. So while somebody comes in and has a baby, we like to educate them right off the get-go as soon as they come in to deliver. But we like to catch them before. So especially those first-time moms, we do offer education during our childbirth classes. But any mom that maybe doesn't want to take childbirth class, or even if it's not their first baby, they can come get even a private breastfeeding class with one of our lactation consultants as well.
Oh, that is wonderful. And involving the whole family really seems to be important too. You know, when you're talking about maybe again that first child again and the entire family, they're just not quite aware of what the picture may look like. Oh, you tap on the door, you want to see the baby. Yeah. They're breastfeeding, and it's okay. And I also lead into breastfeeding in public. Help us as families prepare for, and maybe if we would see that situation in public.
Yeah, I definitely would say if you see a mom breastfeeding in public, do not be afraid. Congratulate her. Just tell her, walk by and say, "Great job, mom," because there's nothing better than to hear somebody, say that you're doing a great thing for your baby. It reminds you, it makes that mom feel not so uncomfortable, because that might be uncomfortable for her as well. I remember experiencing that as a breastfeeding mom, like, how am I going to breastfeed in public? And it was much easier than I thought, and I never had any negative comments. So, us as a community, we can support each other and support our moms in the community that are breastfeeding by telling them they're doing a great thing and great job.
And I'm sure, Lauren, you want to make sure the families are ready at birth. What can families do to help mom get ready from minute number one that child comes into the world? How do we prepare?
Well, one thing we're doing at the hospital is we like to do what we call kangaroo care, or you may hear it called skin to skin. And I love it because it looks like a mom kangaroo putting her little Joey in her pouch in a kind of a way. So right after birth, whether moms have a regular natural birth or they have a cesarean section, we can take that baby within minutes of birth, where our goal is within 5 minutes, and put that baby directly skin to skin on the mom's chest so they can begin bonding right away, and hopefully start breastfeeding then within the first hour, what we call the golden hour. That really establishes how their breastfeeding journey is going to start, and really paves the way for a really successful breastfeeding experience for as long as they want to breastfeed.
Fantastic. We are on the air today, Medical Minutes with Dr. Thomas Rogers from the Cleveland Clinic Union Hospital. And Lauren Smith, who's had a few different hats, you've been wearing a few different ones, but at the Cleveland Clinic Union Hospital Maternity Department, we're talking the lactation services. It gets better all the time. Lauren, let's say there are a couple of other little ones in the family, and here comes another baby. Do you welcome them into the maternity suite when those first few moments of feeding the new child, breastfeeding, is happening? Are they welcome as well?
Absolutely. We're a very family-oriented unit. So a lot of what we do is we really encourage the bonding, especially in that first golden hour, for the mother and baby to bond, and whoever her support person is. And it's up to the mom if she would like, the siblings to come in and see, but we really want to establish that time for mom and baby to bond skin to skin, but definitely those family members, medically permitting, coming in and visiting, especially throughout that whole experience while they're at our unit as well.
And let's hope to make it a more normal scene.
Yes.
And less fear is always the goal as well, if they can observe and watch what hopefully will be happening once mom and baby go home. Thank you so much, Lauren Smith and Dr. Rogers. Lactation services offered at Cleveland Clinic Union Hospital. Let's say we're not quite pregnant yet, but we would like to learn more way ahead of time. Can you talk to me as well?
Yeah, so through your doctor's office, if you're delivering at Cleveland Clinic Union Hospital, they can give you the resources to set up a childbirth class. You can visit our website, the Cleveland Clinic Union Hospital website, and you can sign up online. And if you just would like to talk to a lactation counselor or set up an appointment, whether you delivered with us or not, you can be a mom with a baby of any age. If you have lactation questions or concerns, you can call us at 330-364-0853 and talk to one of our lactation counselors or set up an appointment.
Fantastic. Lauren Smith at the Maternity Department of Cleveland Clinic Union Hospital. Dr. Rogers, anything to add today?
Well, we're just proud of what the maternity team has done. Through Lauren's leadership, be able to get something like this where we can get more information out to the community. And really, the breastfeeding is best. It really improves the child's health and the moms, like she put out earlier. And that's what makes us most proud, is that how they're involved with the community. And that's the key. That's what we want to do, and really make sure that we're taking care of everybody as much as we can here in the community.
This is the month, especially during August, to talk about it with everyone. Good idea to bring up stories from decades ago, maybe within your family, and make it more the norm. I would assume you're really hoping this to happen. And again, Lauren Smith, thank you so much for joining us. Dr. Thomas Rogers from Cleveland Clinic Union Hospital. It is a great month ahead, and we hope to make it a year-round thing to be aware of how just invaluable breastfeeding can be. Thank you so much for joining us on Medical Minutes.
Thanks, Kelly.
Thank you.